Hi, everybody. This is Gigi from Wellness on Wheels, and welcome to our weekly guest appearance. And this week, I have the pleasure of having Dr. Gabby Mahler, our dentist, our mobile dentist that has worked with us for many years. She's a friend and a colleague and an amazing person. She has a lot to tell us today, and I want to start by having her introduce herself and tell us a little bit about her practice and what inspired her to get into it.
Thanks, Gigi. So first of all, I want to thank you so much for having me here today.
My
Uh,
pleasure.
Thank you. Wellness on Wheels is a huge benefit to people who are homebound. It's a great resource, and I'm very happy to be a part of your team. I feel very privileged to know you and to be able to help out your clients, and so thank you for that. So I am a general dentist. I've actually been in practice for 15 years now, which is kind of funny for me to say. And I've been exclusively mobile for 11 years, about 11 years. And as a mobile dentist, what I do is I pretty much bring my office to any patient who is either physically or mentally unable to get into a regular dental office. And so we provide a lot of the same procedures and care that can be done in a regular office in either the comfort of a patient's home or facility to make the process and the experience easier for them. So that's pretty much the nuts and bolts of it. We try really hard to be as conservative as possible with regards to our treatment that we suggest. We can do almost anything that regular dental offices do, but we really try and take the full patient into consideration and them as an individual to consideration. What I usually tell people is that we're trying to improve a patient's quality of life, and there are many ways to do that, and that's our goal.
So what inspired you to get into mobile dentistry? Such a unique practice. I mean, that's not the first thing that people would think of. I mean, I understand a mobile doctor, maybe, a mobile therapist, but mobile dentistry is kind of new in our industry. What got you into this?
So that's actually a great question. I think a lot of dentists would not want to do mobile dentistry, and I completely understand it. It's pretty physical in terms of bringing your equipment, and a lot of times you have to be as focused as you possibly can on the patient and their comfort level. And while a lot of that is done in an office, sometimes that means that you are kneeling down on the floor to be able to see a little bit better into their mouths and things like that. So it's certainly hard. I never expected to be here when I graduated dental school 15 years ago, but I had been working in private practice on the East Coast where I was schooled, and I had been exposed to nursing home dentistry. So a little bit of dentistry in a nursing home. And when I moved with my family out here, I was looking around to see what there was in the ways of dentistry. And I met a man who really set me on my path in terms of my career. He became very much a mentor and a friend to me. His name is Dr. Cal Kurtzman.
Yes, we both know him.
Yes, he was great. And he had actually a private practice for over 40 years in Santa Monica, and he had retired. And when he retired, he accidentally almost started up a small mobile practice for patients who couldn't get out. And people were calling him and saying, what could I do? I have a loved one stuck at home and they need some help. And so I was introduced to him, and I asked him if I could go out with him for a day to see what it is that he does on a regular basis. And I didn't really know what to expect, even though I had been kind of exposed to nursing home dentistry previously. And I went out with him, and we spent the day together going, in his car from patient to patient. And I came home that night and I said to my husband, I think I just figured out what I'm going to do with the rest of my life.
And that was your aha moment, right?
Yeah, it was a real aha moment. It was a real sense of finding fulfillment in a job that it is you can find fulfillment in, and it's great, and making people smile and happy with the way their smiles look is wonderful. But one of the reasons that I went into dentistry was really to help people, and I felt like I was really helping people on a day-to-day basis. And the families that he worked with were so thankful that he was able to do anything for them, and it was just great for me to see, and I really loved it from day one, and now that's all I do.
Right. It's kind of what inspired me as well, is just trying to help other people
Mhm.
to find resources in the community, but also to save them time in terms of going somewhere and, having been debilitated, in their own health. It takes so much time and effort. And even if they're not mobile, like, it would take so much time and
Sure.
cost and effort for them to be transported to see a dentist or to see a doctor or to go get a therapy session. It's so much easier and more convenient and more cost effective when you do the math. But right now we're all pretty restricted. So how has your practice shifted during this COVID-19 quarantine? And what are you doing to address these changes in our time now? And how do you think that's going to affect your practice in the future?
So, a couple of things. So, since COVID-19 has began, the California Dental Association has pretty much told all dentists to stop any routine treatment. So, anything like cleaning, fluoride treatment, any preventive care is really not something that we can be doing right now. It's a risk for the patients. They were concerned that it was a risk for the practitioners themselves. So they really recommended that everyone kind of shut down. And a further recommendation was that we were allowed to see, and we are allowed to see emergencies, but the emergencies have to be real emergencies, not something that you can hold off on, not something that can wait a while. It has to be something that's painful, that could be possibly dangerous for the patient, because they really just wanted to safeguard the community, and they wanted to safeguard any patient that was going to walk into an office and they felt that it was too risky. So that's what's been going on until now. I think it's going to continue for a little bit, although in the meantime, they've been having discussions about what can be done moving forward. So I think one of the things that is going to really change is the PPE that we wear, the personal protective equipment. So as already we obviously wear gloves and we wear masks and a lab coat and things like that. But I think what's going to happen is there's going to be a shift to wearing a lot more things that are disposable. You're going to have to probably wear disposable gowns. So in the few emergencies that I have seen, I can tell you I'm wearing a disposable gown. I'm wearing a KN95 mask, and I'm wearing a face shield on top of that. I'm washing my hands numerous times during a visit when I'm changing my gloves. I am putting on my personal protective equipment before I even reach the room that I'm going to be seeing the patient in, so as not to have any contact with whatever clothing I'm wearing under the equipment and things like that. So I think things are going to get a lot stricter with that. And it's important. It's important to safeguard ourselves, but it's really mostly important to safeguard our patients.
So as we're being quarantined right now, Dr. Muller, one of the biggest things that I'm hearing from families and our current patients is that there's a lot of concern that they're at home with their loved ones, and they're not sure like what they could do if they're supposed to be scheduled for a cleaning appointment soon, and they've never seen their parents' hygiene before, let alone their dental hygiene, and they're a little freaked out about, like, how do you tell your mother to brush her teeth, or you're not really sure she is really brushing her teeth. But there's so much that there's questions about, because it's such an intricate part of our system that many families now are just stressed to the max. They don't really know, oh God, I need care in this area and care in this area. And now you top it off with dental care, and all of a sudden they have a toothache, or their gums are bleeding, or something doesn't feel right. But I'm just wondering what people can do in the meantime until they get to see you. What can they possibly do to help their loved ones or themselves to feel better?
Sure. So that is a great question. I think the answer that you would get from any dentist is obviously to brush and floss after every single meal. But that's kind of, that's an easy answer to give. I think when you're dealing with someone else who you're helping to take care of, and it's not necessarily taking care of yourself, oral care becomes that much harder. It's hard enough for us to do oral care on ourselves, let alone on someone else. I think also when you have the responsibility of taking care of a loved one, a family member, dental needs are one of the first things to fall by the wayside, and that's completely understandable. It's very overwhelming. There's a lot of medical appointments that you need to make it to. There's the day-to-day management of the patient. There's their well-being that you need to take care of. And all of those things understandably come before it. But what are the things that you can do? It's a great question. So one of the things that I always tell people, I'll say this in sometimes when I'm teaching caregivers how to care for a patient's teeth, I always encourage them to drink lots of water, but specifically to give them water after they finish a meal. So some patients, if they are not cognitively impaired, they can rinse and spit beautifully. And so they might not want to, after a meal, go back to the bathroom and do a whole routine of brushing and flossing, but you would be surprised at how much debris you can get out of a patient's mouth if you just give them some water after a meal and have them rinse and spit a few times. So that's one of the first lines of defense that I say. If a patient can't rinse and spit because they're a little bit further along in their cognitive impairment and they're not going to necessarily understand when you ask them to spit, you can just give them a glass of water and they can drink it. That is just a great way to rinse out your mouth naturally. Keep it moist because a lot of these patients take a lot of medications, and so that causes dry mouth, which is another thing that we have to deal with as dentists in terms of breakdown and decay. So that's one of the main things that I'll say. Another thing that would be another level to be able to help a loved one out without necessarily making them brush their teeth, because that's kind of maybe something that they would be a little more resistant to, is to take a piece of gauze, and you can actually do it on yourself. And I've told people to do this when I've given mini tutorials on this. Take a piece of gauze and wipe it across the front of your teeth. Okay, you don't have to go into the lion's mouth. You don't have to go on the inside. I understand the fear of uncertainty and getting bitten and things like that. That's completely understandable. But if you just take a piece of gauze and you rub it on the front of the patient's mouth, on their teeth, if they have food that's on their teeth, there's going to be a lot of it that comes out. And so while it's not as good as brushing and flossing, it's certainly better than doing nothing at all. And I think that a lot of people will allow that to be done to them. And if you get them into a routine of getting used to do it after meals, it can be really helpful.
What about somebody who's got like a little bit of cognitive impairment? You're kind of discovering that they tell you, oh, I did brush my teeth. And you're like, but Mom, the toothbrush is still dry. How could you have brushed your teeth? And there's just a little fear of that buzzing of a electric toothbrush, or, oh, I forgot the floss. And by this time already there's so much plaque, the floss gets stuck and it's a disaster. I mean, it's so many people that I've known and so many of my clients, including my own parents, the dental hygiene part was the most difficult to convince Mom or Dad. You have to actually brush your teeth because it's important. I couldn't explain how important it is medically, but what are some of the reasons that it's so important for us to brush our teeth, and especially for seniors who, really need to be monitored more carefully?
Sure. So a couple of things. So first of all, you mentioned maybe a patient that has a milder cognitive impairment. So one of the things, if it's a family member, if you're a child of someone like that, or even a caregiver, is to almost model for them. Go into the bathroom with them, say, hey, I got this new electric toothbrush. I really like the way it feels when I use it. I got you one too. Let me show you how I use it so that you can have it done. You can do it optimally for yourself. And then, do it along with them. Make it part of the routine if you can. It's hard sometimes. Sometimes they'll be resistant. That's completely understandable. Another thing that you can do is there is a small machine called a water pick. It used to be very in vogue years ago, kind of fell by the wayside for a little while, and now it's really coming back into use. And it's kind of messy. It squirts water all over the place, but it's really helpful for patients who don't have manual dexterity. So they're not, as they're a little older, perhaps, and they're not able to use floss in their mouths, which actually takes a lot of coordination to be able to do, because you're looking backwards at yourself into a mirror. To be able to use it. Another thing that I highly recommend for my patients, and it's something that can be used at home, and it's a lifesaver for my patients in particular, is something called a proxy brush. A proxy brush is it looks like a little pipe cleaner on the end of a stick. Okay. And it's a little, almost like a miniature toothbrush, and you stick it in between the teeth. So it helps for the patient themselves, because a lot of times that's easier than using floss. And it helps if you're a caregiver to use it, because it's easier for the caregiver to get in from the outside of the patient's mouth, instead of having to go in with the floss and popping it in and out in between the teeth. So that's one, some of the suggestions that I would make for a patient with mild cognitive impairment. And one of the other things that you mentioned, it was the systemic, yes, any systemic, I'm losing my words, just what happens systemically when you're not taking care of your teeth, and what is the connection? And so there have been so many studies over the years connecting, most importantly, your gum health to heart health. And that is something that a lot of people now understand more. What I always tell everyone is, the mouth is the gateway to your body. It is not separate. It is the first opening that food goes into, bacteria, especially now in these times, we know anything that's airborne, and you need to keep it as clean as possible. One of the things that I feel like we deal with a lot with older patients is aspiration pneumonia. Okay. And aspiration pneumonia is very dangerous for older patients. And one of the things that I always suggest is to try and keep the bacteria levels in their mouths as low as possible, so that that sort of risk would be minimized. And those, there's a real mind, body, mouth connection. And people are starting to understand that a little bit more. And so that's why I would stress that it is really so important to try, albeit it is very difficult, to just try and keep our loved ones' mouths as clean as possible. And one more thing that I actually was thinking about as I was just speaking now about something that is also helpful to a loved one who has just mild cognitive impairment is you can go to the drugstore and get a regular fluoride rinse. It is over the counter. It's nothing fancy. It has fluoride in it, and it's just an added benefit for a patient if they can rinse with it once a day in the evening time. It is a way to protect the teeth a bit further, and it can go a really long way, and it's effortless on the part of the caregiver and usually on the part of the patient also. And we're just trying to minimize what the caregiver has to do also, because we know that they have so much to do to begin with.
So if somebody is very compromised, for example, they have severe dementia, which is, I'm sure a lot of your patients that you see are on the entire spectrum, but there are people, of course, who are severely compromised. They have Alzheimer's. They wouldn't know what to do with a toothbrush if you gave it to them. Right. You can't just put your finger in their mouth, but no, I'm sure there's some other kinds of things. I've seen those little sponges on a stick that they use at the hospital if they have dry mouth. And, I know the aspiration thing is a big deal, but it's quite dangerous now for people who are bedridden, right? Because I don't know your experience in dealing with those kinds of people and doing dental hygiene. A lot of those patients get basically cast aside. It doesn't really matter anymore. Why should we even bother with their dental hygiene at this point. They're on hospice or whatever. And you mentioned quality of care, which is, a lot of people tout that, but they don't really practice or understand what it's about.
Mhm.
And I think in your field, it's essential to
Yeah.
make a difference in somebody's quality of life um, when they're totally compromised. So if you're dealing with somebody with Alzheimer's who's just, or Parkinson's or whatever severe, compromising disease, how do you address those points?
So one of the things that I stress to people is, in the nature of this business is that you see a lot of emergencies. And so and I understand, again, because there's a lot on someone's plate when they're having to deal with this. But one of the things that I really try and stress is that we try to be as conservative as possible with whatever treatment we're suggesting for a patient, because we don't want to put them through so much.
Yeah.
Again, because of quality of life, we want to make sure they're out of pain and they're as infection-free and comfortable as they can be. But one of the things that we're more aggressive on was exactly something that you mentioned before: dental hygiene. So I always say to people, I want to see patients more often for cleanings and give them fluoride treatments and give tutorials to the caregivers on how to keep their teeth clean in between visits, because all of that is going to help me have to honestly do less later. And that is really my goal in all of this, is to maintain a patient while doing really as little as possible and just trying to remain conservative. So
That's really honorable, because as we all know that whenever you go to a dentist, sometimes it's almost like going to a mechanic. It's like,
yeah.
oh no, it's this little thing, and then all of a sudden there's these huge, numerous things. So it's nice to know that you're conservative, and we look forward to having you come back into the community and practice the way you were before, once we lift the quarantine and we can roam about the cabin freely as we all want to do. But it's been an honor and a pleasure having you. I hope this helped a lot of people get some tips on how to take care of themselves and their loved ones while we're locked up, basically. So we do what we have to do, Dr. Mahler, right?
Yes, we do what we have to do. And I really hope that what you said happens, that we can just kind of go about what we do in helping our clients and our patients a little more freely than what's going on right now. I'm sure they really need us. I know they really need you. I think that you make such a difference in their quality of life with all of the options that you can help them with. And I just hope that that is what happens in the next couple of weeks. Things kind of open up again, and we're able to help take care of them again.
And in the meantime, we're both available for consultations. If our patients still need us, we're still here to advise them. And you do go out in the case of emergencies. So it's good to know that that's still available, because most people are afraid that they can't be seen if they're in pain. But you make that judgment call, and you help everybody out. And it just makes a huge difference knowing that there's still many people available to care for our loved ones. So with that, thank you so much, and we look forward to seeing you again soon. Thank you so much.
You too. Take care, Gigi.
Bye.
Bye.